all parts of the body. It is studied in thorax in the following three parts: ascending aorta, arch of aorta, and the descending thoracic aorta. Ascending aorta. The ascending aorta arises from the upper end of the left ventricle, about 5 cm long, and is enclosed within the pericardium. It begins behind the left half of the sternum at the lower border of the third costal cartilage. Now, it is running upwards, forwards, and to the right side, and becomes continuous with the arch of aorta at the sternal end of the upper border of the right second costal cartilage. At the root of the aorta, there are three dilatations of the vessels called the aortic sinuses. The sinuses are anterior, posterior, left side, and posterior right side. Relations: anteriorly the sternum, the right lung and the pleura, infundibulum of the right ventricle, root of the pulmonary trunk, and the right aura. Posterior relations: transverse sinus of the pericardium, left atrium, right pulmonary artery, and the right bronchus. It is found posterior. To the right side, superior vena cava and the right atrium. On the left side, pulmonary trunk above and left atrium below. Branches: the right coronary artery arising from the anterior aortic sinus, and the left coronary artery arising from the left posterior aortic sinus. The arch of the aorta. The arch of the aorta is the continuation of the ascending aorta situated in the superior mediastinum behind the lower half of the manubrium sternum. It begins behind the upper border of the second right sternochondral joint, runs upwards and backwards and to the left across the left side of the bifurcation of the trachea. It then passes downwards behind the left bronchus and on the left side of the body of the fourth thoracic vertebra, okay, in front of T4. After which it arches over the root of the left lung, ending at the lower border of the body of the fourth thoracic vertebra by becoming continuous with the descending aorta over here. Thus, the beginning and end of the arch of aorta are lying at the same level, although it begins anteriorly and ends posteriorly. Relations: anteriorly and to the left, four nerves from before backwards. We have the left phrenic nerve, right? Lower cervical cardiac branch of the left vagus, this is the vagus. Superior cervical cardiac branch of the sympathetic chain and the left vagus itself. Then it also has the left superior intercostal vein deep to the phrenic nerve and superficial to the vagus. This one. They are superficial to the vagus and deep to the phrenic nerve. The left pleura and the left lung, and remains of the thymus gland as well. Posteriorly and towards the right, we have the trachea, with the deep cardiac plexus and the tracheobronchial lymph nodes, the esophagus, the left recurrent laryngeal nerve, thoracic duct, and the vertebral column. Superiorly, we have the three branches of the arch of aorta: right brachiocephalic, left common carotid, and left subclavian. All three arteries are crossed close to their origin by the left brachiocephalic vein. Inferiorly, we have the bifurcation of the pulmonary trunk, the left bronchus, ligamentum arteriosum with superficial cardiac plexus on it, and the left recurrent laryngeal nerve. Branches of aorta, we have the brachiocephalic artery, which is dividing into the right common carotid and the right subclavian. Then we have the left common carotid artery and the left subclavian artery. Next, the descending thoracic aorta, this one. Descending thoracic aorta is continuation of the arch of aorta. It is lying in the posterior mediastinum. Continues down as the abdominal aorta, which ends by dividing into right and left common iliac arteries. It begins on the left side of the lower border of the body of T4 vertebra, descending with an inclination towards the right and terminates at the lower border of the 12th thoracic vertebra over here. Relations. The anterior relations are the root of the left lung, the pericardium and the heart, esophagus in its lower part, and the diaphragm. Posterior, we have the vertebral column and the hemiazygous vein. To the left side, we have the left lung and the pleura. On to the right side, we have the esophagus in the upper part, the azygous vein, thoracic duct, right lung, and the right pleura. Branches. Nine posterior intercostal arteries on each side for 3rd to 11th intercostal space, right? Subcostal artery on each side, 2 left bronchial arteries, 1 right bronchial artery arising from the 3rd posterior intercostal artery. Okay. Then we have the esophageal branches supplying the esophagus, pericardial branches supplying the posterior surface of pericardium, mediastinal branches to the lymph nodes and areolar tissue in the posterior mediastinum, superior phrenic artery to posterior part of the superior surface of the diaphragm. Branches of these arteries anastomose with those of the musculophrenic and the pericardiophrenec arteries. Yeah, now the phrenic nerve. The phrenic nerve arising from C3 to C5 cervical nerve is a mixed nerve, carrying the motor fibers to the diaphragm and sensory fibers to the mediastinal pleura, pericardium, and part of the peritoneum as well. The right phrenic nerve. Right phrenic nerve is shorter, vertical, and deeply placed, whereas the left phrenic nerve is longer, it is more oblique, and not very deeply placed. It is crossing the second part of the right subclavian artery. It is crossing the first part of the left subclavian artery. It is running along the side of the venous systems, the superior vena cava, and passes through the caval opening of the diaphragm. It is running along the side of the arterial system and pierces the left cupula of the diaphragm. Clinical anatomy. What is aortic knuckle? In the posterior anterior view of the radiograph of the chest, the arch of aorta is seen as a projection beyond the left margin of the mediastinal shadow. This is called the aortic knuckle, which becomes more prominent in old age. Okay. So, what is this coarctation of aorta? It is a localized narrowing of the aorta opposite or just beyond the attachment of the ductus arteriosus. In extensive collateral circulations, development develops between the branches of the subclavian artery and those of the descending aorta. These include anastomosis between the anterior and the posterior intercostal arteries, producing a characteristic notching of the ribs. So before that, about the coarctation of aorta we had read, and then there was this ductus arteriosus, ligamentum arteriosum, and patent ductus arteriosus. What are these? During the fetal life, the ductus arteriosus here is a short white channel connecting the beginning of the left pulmonary artery with the arch of the aorta, immediately distal to the origin of the left subclavian artery. It conducts most of the blood from the right ventricle into the aorta and short circuiting the lungs. After birth, this is closed functionally within about a week and anatomically about 8 weeks. The remnant of the ductus forms a fibrous band called ligamentum arteriosum. The left recurrent laryngeal nerve hooks around this ligamentum arteriosum. This ductus remains patent after birth, and this condition, if so remains, is called the patent ductus arteriosus and may cause serious problems which could be surgically treated. So, what is an aortic arch aneurysm? It is nothing but a localized dilatation of the aorta which may press upon the left laryngeal nerve. This is the left laryngeal nerve. This is the ligamentum arteriosum. Left leading on to the paralysis of the left vocal cord and the hoarseness. It may also press upon the surrounding structures and cause mediastinal syndrome, that is the dyspnea, dysphagia, and dysphonia. The pulmonary trunk. The wide pulmonary trunk starts from the summit of infundiculum of the right ventricle. Both the ascending aorta and the pulmonary trunk are enclosed in a common sleeve of sinus pericardium in front of the transverse sinus of pericardium. The pulmonary trunk, carrying the deoxygenated blood, overlies the beginning of the ascending aorta. It courses on to the left and divides into the right and left pulmonary arteries under the concavity of the aortic arch at the level of the sternal angle. The right pulmonary artery courses to the right behind the ascending aorta, is behind it, and the superior vena cava, and is anterior to the esophagus and becomes a part of the root of the lung. It gives off first branch to the upper lobe before entering into the heart. Within the lung, the artery descends posterolateral to the main bronchus and divides like the bronchi into lobar and the segmental arteries. The left pulmonary artery passes to the left anterior to the descending thoracic aorta to become part of the root of the left lung. At its beginning, it is connected to the inferior aspect of the arch of the aorta by the ligamentum arteriosum, which is a remnant of ductus arteriosus. Rest of the course is same as that.